Good evening and welcome to Confident Nutritionist, Dynamic Iridology, Bone and Skin Markers. Welcome. I am so glad you're here. Thank you for coming. It would be really boring to do these by myself. It really would. It's so much more fun when there's people participating. Even though we're only going to be together for a short time tonight, I promise that this will be time well invested for you. I always schedule 90 minutes for these sessions just in case we need it, and we likely will tonight. So I hope you've blocked off 90 minutes in your schedule as well. Regardless of whether your specialty is nutrition or herbology or some other line of holistic healing, I know you will leave our session today with information you can use with your clients. That's the whole goal here, right? One thing I've learned in my many years in the holistic wellness industry is that excellent healers keep learning. They just do. They know they don't know it all. And so I congratulate you for being in the minority who continue to learn and who strive to be your best and who strive to give your best to your clients. I'm excited to have you with me. I hope you can tell. I hope my voice sounds excited because I love teaching this stuff and I love it when you join me for this. I want to start with a little poll tonight, and I just need to shrink one window here. There we go. I want to start with a poll tonight to get to know you a little bit so that I can tweak the presentation if I need to. I can do that on the fly. So I'm inviting you to play all in tonight, to participate when I ask for input and answers and these little polls. Please do that. What training do you have in holistic health? Are you a herbalist, a nutritionist, homeopath, naturopath? Do you do body work, energy work? Not much yet. You're just starting out. And you can check off as many of those as you want. If you do them all, well, if you do them all, then you're not just starting out, are you? And we are a small group tonight, so I encourage you to all weigh in on this. And I know we've only had one person vote so far. Good, there's two. That's awesome. And I don't know who the third person is, but you're guilty as charged. So I'm just going to ask you, yay, thank you. I appreciate that. So all of you have nutrition background, and we have someone who also has the herbal background and someone who's a homeopath naturopath. Awesome. That's fabulous. Well, welcome. I can really tweak this tonight to be specific to what you need, and I'm excited that you are with me. With your training, you may be facing some challenges. And just before we start looking at the iridology markers that I promised to teach you tonight, I want to spend a few minutes looking at why you need iridology in your wellness practice. Some of the challenges that we face as holistic practitioners, we actually create ourselves, and some of them we were taught to create when we went to school. For example, when you went to school, you probably did a lot of case study work, but that's not how you practice in real life. Right? You don't write these big, beautiful reports and give them to your client as a package deal. That's called fire hosing. You're giving them a lot of information under a lot of pressure, and it doesn't work very well. So let's take a look at some of these challenges. The first is that you might not know exactly where to start in your recommendations or how to set therapeutic priorities. You know a lot of stuff, right? You went to school for a while. You know a lot of stuff. And if you are just starting out in this, I know we've got someone who's joined us who is brand new to the field. If you're just starting out, once you've got some training under your belt, you may have problems sorting out where do you want to start. And the problem is, so often in school, we are taught to use intake forms. We are taught to use questionnaires. The questionnaires ask a lot of questions, most of them very general, most of them totally irrelevant to your client. And that can really muddy the waters for you, and it can waste a lot of time. So maybe what you really need help with to help you be the best you can be and give the best you can to your clients is a little bit of training to help you figure out where is your starting point and what is the sequence of things you need to do with your client over the next 3 or 4 or 5 or 6 months. The second problem that most of us have had or have now as nutritionists or herbalists or holistic practitioners is that we spend a lot of our own time doing research and writing up beautiful reports for our clients, but because it's on our own time, we're not getting paid for it. Again, sometimes we do that because we feel like we need to give really good value for the money they've paid, but what we're really doing is we're not giving good value. There comes a point in time when you give too much information for what they've paid and they can't follow up with it, right? And that's where we run into problems with overwhelming our clients with so much information that they don't come back after the second consultation. So they come in the first time, you ask them lots of questions, have them fill out that stinky questionnaire, you give them a starting point, you send them away, you go and spend 2 or 3 or 4 hours of your own time for which you usually aren't getting paid. They come back, you give them this huge, beautiful package of information, and they have one of two reactions. The first is they grab the 2 pieces of information out of that packet that they think they need, and they never need to come back to you because they know everything they need to know. Or the second is they look at it and they go, I could not possibly do all of that. You're crazy. I can't do this. I am so out of here. Right? And so they don't come back either. That's a challenge because that means that you are always looking for new clientele. You don't have a really good repeat clientele business. I have got clients that have been with me for 30 years. Yeah, you heard that right, 30 years. And I don't see them every 2 or 3 months anymore. They don't need that. But they come in about once a year, maybe twice a year, and they're just doing tune-ups because they like having tune-ups done. Now, do any of these challenges sound like you? You have problems knowing where to start. You spend your own time writing up reports and doing research to take back to your client, and you're not getting paid for that time, or you maybe give your clients way too much information. If you're guilty of any of these, please raise your hand. Brenda says yes, yes, and Tanya says yes, yeah, got it right. Who needs it? We don't. We need to. Thank you so much for weighing in on that. We need to stop that because it's not good for business. Not good at all. So how do I know what your challenges are? Okay, true story here. I've been there myself. You should have seen how complicated the homework was that I used to give my clients when I first started out. Even using Iridology, because nobody taught me how to break the homework down into doable, non-threatening pieces. I was guilty of the 1-hour appointment, last 3 hours, give them that much information, wondered why they weren't coming back. And the second point is I've interviewed a lot of nutritionists and herbalists and other holistic practitioners, and almost all of them have been there too, and some of them are stuck there. So if that is you now, you're not alone, but you don't need to stay there. We can totally get you out of that. So who am I? And what qualifies me to share this practice-changing information with you? Well, my name is Judith Cobb, and that is me in that sort of low pixel picture. I need a new one. I've been a holistic health coach since 1981. Now, fun fact, I won't embarrass her by saying who she is, but we have a student with us tonight who is the granddaughter of one of my clients. Yeah, okay, so that's how long I've been in business, right? So glad that she's with us. That's exciting. I've been a holistic health coach since 1981, master herbalist since 83, nutritional consulting practitioner with the IONC since 94, a natural nutrition clinical practitioner with the CANNP since 2016, certified iridologist since 93, certified comprehensive iridology instructor since 2016, although I've been teaching iridology for a lot longer than that. I just decided to get quote-unquote official lately. And teacher of wellness professional since 1985. You know, when I started in 1981, I was blessed to be able to apprentice with another lay practitioner here in Calgary for nearly a year. And we'd had our first baby before I went to work with her, and she was happy with me bringing the baby along. That was fine. And that baby became a toddler, and just before I left apprenticing with her, we were expecting our second baby. And there was no way I was going to take two babies to work. That just didn't seem like the right thing to do. And so that was when I broke off and started my own business in 1981, when it was probably 82 when I actually started my business. But because of studying with her, and because I continued to take classes just like you are, I began teaching wellness professionals in 1985. There were not very many classes back then. Everything was in Arizona or California. Or you could do mail order classes where they would send you audio tapes, cassette tapes, in case you know what those are, and photo slides, in case you might know what those are. We're talking ancient history here. And you would do your homework and you would mail it in, wait for them to send it back with the next lesson. Okay, that's how it used to be before the internet. I mean, even back then, telephones still had cords, right? Some of you remember phones with cords too. But I started teaching because I realized that here where I live, again, we didn't have the internet. I couldn't have this beautiful group of people that we have together now, because you people are all over North America, right? Couldn't do that back then, but I started teaching locally, and people were hungry for it, and that's just how it started. I'm also the wife of one, the mom of 7, and the grandma of 7, and of course, those are some of my most proud accomplishments. But you need to know, it hasn't always been fabulous. I have made every mistake you can make in a holistic wellness business. I have spent a truckload of money, some of it was money I didn't have, taking courses and trying to get training. And you know, some of those courses and some of those trainings were duds, complete and total duds. And what I learned from them was how I would never teach a course, or, well, that instructor doesn't give good value, right? A few of the courses were really worth my time and my money, and they are what have helped me to get my business to where it is now. And that's really exciting. And you know, you win a few, you lose a few, right? And you don't cry over spilled milk, you just move forward. You take what you can and you move forward. You learn what you can and you move forward. So would it work for you if I could teach you some of what I've learned to save you time and money and frustration and discouragement from making some of the mistakes I've made? If it would be of interest to you, please raise your hand, because then I'll know that I'm really talking to the right people. Awesome. Yeah. All right. Good. Thank you so much. Thank you so much. Really appreciate that. Well, Iridology can help you eliminate your intake forms except for your waiver release form. You have everybody sign a waiver release form, even your mother. I have just actually instigated having my clients sign a new one annually, right? Because it's changed a little bit. Now I do a few different things, and I need to make sure that they are okay with it, and I want their permission, and I want them to understand the limitations and where the limitations don't go. So I actually have them sign a waiver annually. Even if I only see them once a year, they sign a new dated waiver annually. Iridology can help you to start creating deep rapport from the moment you start the consultation, instead of looking down to read that awful intake form. You know what? I remember back when I was having babies, mostly is when I've seen a doctor. I don't usually see a doctor, maybe once every 5 years for baseline blood work. But back then, the receptionist would put my file in a little holder thing outside the exam room door. The doctor would pick that up, come into the office looking down at the file, reading to find out where we were the last time I spoke with him. Now, what happens is you go in and you wait in the exam room. The doctor comes in and he goes straight to the computer and turns it on. So he's looking at the computer, not at you when he comes into the room. There is no eye contact. There is no rapport. This is not good. As holistic practitioners, we need eye contact. We need rapport. If you need to review the file, stay outside of the room for a couple of minutes, review, get familiar, and then come in. Or come in, talk to your client for a few seconds, eye to eye, and then open the file and start to do what you need to. Iridology can help you do a core assessment in less than 5 minutes. Know all the right questions to start with, prioritize what needs to be dealt with first, and create a therapeutics priorities list or sequence for future consultations. It will also help you to eliminate your unpaid homework time, because you are going to do your program design as you are sitting with your client. No more going off and spending your own time for your clients. And you will stop overwhelming your clients because you will know where you're starting and where you're going. You want to make it a point that when you're working with a client, they always bring in a shopping list, right? I call it the shopping list. It's the list of things they want your help with. And the first thing they mention is 99.9% of the time the thing that is the most important to them. It's the thing that's bugging them. So I write down that shopping list as they give it to me, and I asterisk or I number them in order, the order that the client wants them dealt with in. Yeah, okay, that was probably bad syntax. And then I do the iris assessment. And I do that primarily, I do the big assessment in the first appointment and then little looks appointments thereafter if I need to, because I've made notes, so I may not need to look again for a few times, right? And so I will always tie in what I'm seeing in their eyes with what I've written down on their notes. So if they've come in with problem A and I can find 3 corroborating indicators in the iris and or sclera, then I know that's where I want to work, and because I've seen those indicators in the eyes, I know how I want to work. Okay. I've had a lot of students who have come to me for this course over the years, back before I taught it as a certification course, and more recently since I've added the IIPA certification levels, who were actually trained iridologists. They were trained by other very well-known names, very well-respected teachers, but they were not taught how to integrate herbology or nutrition with their iridology. And it is such a shame, because what that meant is because they didn't know how to integrate it, they weren't using it. I had one student who had purchased an iridology camera, $5,000 worth of equipment, and she'd purchased it about 7 or 8 years before she took my class, and it had sat in the corner still in the original cartons until she took my class. Then she understood how to integrate it with what she was doing. She uncrated that and off she went. So if you are in that same position, maybe you have some iridology training and you don't know how to integrate it, just stay with me. Stay tuned. I'm going to show you, we're actually going to integrate tonight, show you how to integrate it, and I'm going to show you the kind of power and clarity iridology can add to your consultations. Does that sound too good to be true? Because you know, with iridology, you can literally gather that base of information, let it teach you what questions to ask. The assessment becomes a part of the rapport building intake without wasting your client's time to fill out 2 or 3 or 20 pages of intake. And yes, I've spoken with practitioners who use 20-page intakes. I spoke with a practitioner who actually became a student of mine for one of my first go-rounds of this course, and she confessed to me she had just spent 3 hours with a client when they had only booked and paid for 1. So that's one problem. And, you know, I mean, truthfully, she's helping the client, right? You got to give her that credit. She's helping the client. But the other side of that is she's giving so much time away that that client now begins to expect 3 hours for the price of 1. She has devalued what she does. And then that client tells her friends, you've got to go see so-and-so because, you know, she'll only charge you for an hour, but she's going to give you 3. How do you stop that bus? Brenda says, excited for this. I have all the training, including iridology, but haven't started with my own clients yet. Well, Brenda, you're in the right place. You are in the right place then. Let's see what we can do to help you along with this. Now, the second problem we have with this questionnaire thing is that same practitioner said that she'd had a client in that day, And her client had 3 pages to fill out, but after the first page, the client complained about how much her arthritic hands hurt doing all this writing. So we just don't want those lengthy intake forms. They are not useful. Let's get started. Let's get started with some iridology. You're thinking, oh, I wonder when. It's about time. So you need some equipment to do this, right? You need some equipment. Eyes are small. You could go out and spend $5,000 on a high-tech iridology camera. This is my camera. I absolutely adore it. I upgraded to this one this last March or so, and oh, I have not looked back. I just love this. But this is not where I started. This is actually my 3rd camera. I didn't start with a camera, and neither should you, unless you are trained already and you're really comfortable with this and you know you love it. We all started here with some kind of a magnification device. This is a jeweler's loupe. It's an 8x magnifier with a really good pen light that has a really white light. Now, you know, when I started, we didn't care what color the light was. We just wanted a light. Now you can get really white lights, and that's what you want. Or we started here with a lighted magnifying glass. Now, I suggest that you have both of those. You know, for $75 on Amazon or at a stamp collector shop, you can get what you need. I like having the 2 setups because this one has the lighting fixed, which means that it stays in the same position in relation to your lens. I also like this, and that's a good thing for some things. This also, as you can see a clip here, this I got on Amazon. It has 2 other interchangeable lenses. So I think it has a 3x, a 5x, and a 10x or something like that, which is great because I can swap out lenses and see different things. But you also want this kind of a setup because there are times when you want to move where the light is in relation to your magnification. You want to throw shadows. The shadows will show you different things. And so I really suggest that you spend $75, get both kinds of setups, and work from there. So go ahead and get yourself some really good basic equipment. I still use this basic stuff in every appointment. You know, anytime I want to look at eyes, if I've already got their eye photos, and I do eye photos annually now, and so when I have them sign their new release form, I do new eye photos because I want to monitor things in the sclera especially, and there are some iris markings that I want to monitor as well. And so, I am getting photos annually, but there are often times in an appointment when I need to look at the eyes and just double check something, and so I will use the handheld. So go ahead and grab that kind of equipment. Like I said, it's easy to get. The most common bone and skeletal conditions are osteoporosis. And this is, of course, we know this one, right? This is very prevalent. Bones become less dense and more fragile. For any of you that might be in the UK, do we have anybody who's in the UK with us tonight? I would doubt it because it's like 1 a.m. over there. Okay. There are over 3 million cases of osteoporosis in the US or in the UK. How many of you are in the United States? If you'd raise your hand if you're in the United States. Any of you? Okay. Good. Thank you. Thank you. 10.2 million cases of osteoporosis in the US, and 43.4 million people have low bone mass that hasn't quite reached the osteoporosis stages yet. 1/2 of the total adult population has some degree of bone thinning. Is that scary or what? And here in Canada, so if you're in Canada, raise your hand. Let me know where you are. Canada, Canada. Yeah. Okay, awesome. Fabulous, thank you. In Canada, we have 1.4 million cases of osteoporosis. 1 in 4 women and 1 in 8 men over the age of 50 in Canada have full-blown osteoporosis. It is the most prevalent metabolic bone condition. So can you imagine if you could see in the eyes indicators that say, this body wants to have problems with bone density, but you saw that when in someone who was very, very young, how you might impact their life? Even if you saw it in someone who was 60 who hadn't yet been diagnosed with full-blown osteoporosis, but we know by age 60 they've lost some bone mass. If you see it at the age of 60 and you know what to do with it, can you imagine how you could change their life? It is very, very powerful stuff. Osteopenia, osteitis, deformans, osteomalacia. These are more bone conditions that have very similar end results to osteoporosis. And scoliosis, which is the sideways S or C curve to the spine. Kyphosis, which is that rounded back. It's where the back rounds, particularly in the shoulder blade region, sort of a bit of a hunchback. And lordosis, that super sway back in the lower back. These are all very common abnormalities of the spine. Now, I have a feeling about these things, and I don't know if I'm right or not, but I'm going to share it with you anyways, and let's see where it lands. And that is that when we see someone who has really bad posture, whether it's scoliosis or they've got a little bit of the kyphosis happening particularly, it's not usually because the bones are demineralized. That's not how it started usually. Usually it started because of weak muscles. And as the muscles are weak and not holding the body properly, the bones remineralize and remodel to accommodate the new shape the body wants to be in. So if we can remodel the bones to become a hunchback, for instance, or to have scoliosis, why could we not strengthen the muscles, balance the muscles properly, and begin to encourage the bones of the spine to remodel in a more correct posture? I would love to have the opportunity to test that out on some clients. Work with a personal trainer and get them exercising, and see what we could do to correct their bone shape, the actual bone shape. Our first iris marking is called osseous netting. These are the eyes of a 4-year-old girl. This little girl's mother has been the most, what's the word I want to use? She's an only child. I'll paint the picture. She's an only child, and she was the hard-fought result of fertility clinic and a whole bunch of herbal work. Okay, so does that paint a picture? Every child is precious, I get it, but how precious this child is to this mother and father. This mother has been overly anxious to do everything right for this child's health. Okay, so here we have osseous netting. Osseous netting from a distance looks like this. You see how most of the fibers run in and then come out. Osseous netting is these fibers that mesh back and forth. They're going across the grain, kind of a bit of a tangled mess. In the enlarged photo, we see them here and here. We have some more of it up here. Okay, so these aren't the clearest pictures we're going to look at today, but you can see this. Now, osseous netting is a genetic indicator. There's nothing this little girl did to put this here. This is her genetic structure. She inherited this indication. This is a very, very fine sign, which means you may not be able to see it with handheld equipment. So if you're looking for it with a 10x magnifier, you might not see it. I mean, I don't know what size of screen you're using, but I'm using, I think it's a 22-inch screen. So this iris is a full 6 inches across, right? And we can see the osseous netting here. This is just, this little section here, at least doubled in size. So if you don't see this with handheld equipment, don't kick yourself around the block for it. But we do see this osseous netting here. And she has it on the other side of her iris as well. You can see it over here. Okay. So when we see any marking, we want to ask a lot of questions. And the questions we ask when we see osseous netting are, is there a personal or family history of any kind of bone issues? Now, bone issues can be anything from osteoporosis to leukemia, right? We're working with the mother of a 4-year-old child. How is the mother going to react if we say, do you know if there's any bone issues in the family, as you're looking at her child's eyes? I want you to type in, what do you think the mother's reaction is going to be? I've told you a bit about this, Mom. Yeah, Brenda, yeah. Panicked, scared, worried, yeah. Tanya says she might react a little more coolly. Why do you ask? Okay. I would hope she would respond that way, but I would also hope that we would not put her in that position where she has to take that step back and be cool, calm, and collected. I know this mother quite well because I started working with her before she conceived this child, about 2 years before, and supported her through the entire pregnancy. And so we've been together for nearly 7 years now as practitioner and client. And I know that if I said, is there a family or personal history with your daughter of any bone disorder, she would totally flip. I'd be spending the next 2 years talking her back down to earth. So we need to find ways to ask parents, especially when we see these kinds of signs, these questions without alarming them. So something like, I see a marking in my eye that makes me wonder about parents, grandparents, and aunts and uncles. Do any of them perhaps have any kind of a bone thing going on? You know, and if the mom says yes or no, then we can say, you know, your daughter has an indication here, but the great thing about it is she's so young, her bones still want to be mineralizing, so we can totally take everything that you're doing that is so good for her and minimize the risk as she gets older. And really take the fear that the mom would want to put in the here and now and put it 50 years down the road and talk about, you know, your daughter wants to, as she gets older, potentially have some issues with bone density. But if we start now, while her bones are still really strong and really good, we can really reduce that risk when she's 50. So it's an empowerment process, and that's what we need to do. We need to use this as an opportunity then to teach sound nutrition if we need to, and to teach lifestyle as preemptive measures when we're working with children. This set of eyes is from a female age 35. And you can see that, again, when we take that step back, we can see a bit of the osseous netting here. There's some more down here. Kind of comes up here. She's got it kind of generally all over. And when we look at the enlargement, again, we can see how things get a bit tangled up in here. So again, this is inherited. She did not do this to herself. This is what she got from her parents. And we need to clarify with our clients that the presence of an inherited marker suggests an increased risk for reduced resiliency in that area of the body. It is not a guarantee of the problem. The converse is also true. You could have a person who has not a single marking in their eye. They've got the most perfect irides you've ever seen, but they go off and they do the Twinkie and Coca-Cola diet. They never work out. They never do anything physical. They're totally sedentary. They could earn the right to have osteoporosis by virtue of the fact that they have not cared for their body properly. So having a sign in the eye, having a marker in the eye, is no more a guarantee that the person will have the problem or does have the problem right now than buying a lottery ticket is a guarantee that you're going to win. We want to use iridology as a screening tool. It is not a diagnostic tool. It is a screening tool. When we see a client for the first time as an adult, we still need to ask the personal and family history questions. And then we need to start putting as many markers together to support things as we can. So when we see the osseous netting, it suggests this person wants to have some kind of a bone issue. And we would normally, unless they've mentioned some other family history like leukemia or osteomalacia or something like that, we would normally think osteoporosis. And I just want you to pay attention to a couple of things. We're going to touch on these later. When we look at the edge of the iris here, we see how there's little snippets. You see those little snippets? It looks like someone took teensy-weensy scissors and cut little bits out. That's one thing. The other thing is when we look at this area, it's not the same color as the rest of the eye. It's kind of, on my screen, it looks kind of mauvish or purplish. Depending on how your screen's color settings are set up, it might look pinkish. So those are two other things. And if we see these three things, we'll look at this again in a bit. We are really going to have a conversation about nutrition, digestion, and bone density because they all go hand in hand. So we're going to need to do some coaching on diet and lifestyle. We're going to ask about personal and family health history as well. If we were going to ask about diet, what are some of the foods that you would want to know about in this person's diet that might be causing problems for their bones? Brenda, you are fast on the mark. Holy doodle, you've got a good connection. All right, we've got 2 people weighed in. Yeah, we've got 3 people weighed in. Excellent. Oh, yeah. Awesome. Okay, let's read these because these are good answers. And thank you for playing with me on this because it's so much more fun when you do. Brenda says dairy products. Yeah. The 4 countries that have the highest dairy consumption also have the highest rate of osteoporosis. Processed foods, absolutely. They are a bad thing. Sugar, processed, and acidifying foods, yeah. And the high sugar diet, absolutely. Those are all things that we want to know about. To that list, I would add excessive red meat consumption, coffee, tea, and green tea, refined carbs, which were mentioned in a way when we were talking about sugar, carbonated beverages. Carbonation is really bad for the bones. Dairy products. I would also want to know, and these aren't necessarily food, well, water. I want to know their water intake. And I would also want to know what their exercise habits were, right? Because exercising way too much and not supporting that nutritionally is as bad as not exercising enough. And exercise doesn't have to be a spandex workout. We're talking physical activity here. Here we have some more osseous netting. This is a female age 60. And you can see over here that we've got a little bit of osseous netting happening here. But we really have it on this side of the eye. Look at this whole tangly area where we've got all of this osseous netting. Remember, this is a genetic sign. Just because she's 60, it doesn't mean she's done anything to put this there herself. It's always been there, just as we see it now. We're going to come back to this set of eyes, I think, later on because it's got some interesting marks that are going to help us determine what we want to do, what we want to recommend for this client. Here's another set of osseous netting eyes. You can see we've got lots of bits of it down here. And we've got lots of bits of it up here, and you can see it in the blow-ups as well. This is a 72-year-old female. And she's not aware of any bone issues. At the age of 72, we know she will have lost some bone mass, correct? Because we know that starting about the age of 40 to 45, we start losing 0.5% of our bone mass per year. So she's probably down 10 or 15% anyways. But she's got a lot of other big problems that actually are probably more serious than her risk of osteoporosis. She has some major circulatory problems, some major respiratory problems. She carries oxygen with her. As long as she does, she's good to go. She does really well as long as she's got her oxygen. But she may not be as badly off with her bone density as some other people might be because she does stay as active as she can, and she's very diet conscious. She doesn't eat junk food. She doesn't eat high acid foods. She doesn't eat sugar and white flour. She's been very conscientious for many years. So what kinds of foods would you want someone where you suspect there might be some bone density issues to include on a daily basis. And you know what? If you've got a herbal background, I'll throw in some herbs just for kicks. What kinds of foods would you want her to be including? Yeah, Tanya, good. We'll read those in just a second. Yeah, Brenda, yeah, and Tanya, ooh, good ones. Yeah. Yeah. Anyone else want to weigh in on this while we're reading these? Tanya says greens, nuts, and seeds. Absolutely. So your leafy greens especially. And Brenda says leafy greens, yeah. And Tanya adds other vegetables. Yeah, a high vegetable intake diet. BFC by Dr. Christopher. Excellent, Brenda. Good suggestions. So that is a bone formula by Dr. Christopher. So herbs that are high in minerals, particularly calcium, as well as the other minerals that might help with the bones. Now, we look at this list and we go, okay, leafy greens, nuts, and seeds, sometimes whole grains, right? Depending on their constitution, they may handle whole grains, okay? Now, depending on the person, oats may not be the best option. For some people, they're good. For some people, they're not. The phytic acid in there, if they are going overboard on their oats, can block calcium assimilation. We want them to be drinking water. We want them to use vitamin D3, especially if you live as far north as I do. You need the D3. This time of year, our daylight hours, we're getting down to about that 6 hours a day mark of kind of sunshine. It's not really bright sunshine. And I know one of the people on our call has lived 8 hours north of here, where it's more like 4 hours of kind of sunshine, barely kind of sunshine. So we need the D3, particularly in the winter, not so much in the summer if we can get out there. Vitamin K2. K2 has been found to be super important in bone. Yeah, Tanya, good job for suggesting K2. Well done. I didn't notice that before I read that, or I would have, before I read it off my slide, or I would have given you credit for that great idea. Silicon, zinc, boron, manganese, magnesium, calcium. One that I left off here. Anyone want to guess the one that I left off, that I forgot to put on the list? Our bones are really complex, aren't they? What about phosphorus? We need the right amount of phosphorus because it helps as well with keeping our bones and teeth hard. And so we need that as well. Our bones are very dynamic. They are not dead material. They are living material. And they are constantly undergoing an exchange of minerals all day, every day. We need to remember that calcium is the first thing that gets pulled out of our bones to help neutralize excess acid in the system. And so if we're not putting in enough calcium, then we are replacing everything that's being pulled out to neutralize acid. So we want to really make sure we're getting enough of all of these nutrients. And if we can get them from dietary sources, more power to us. But sometimes, even with the best food sources, we are unable to get the job done. This is a female, age 28. And what I want you to look at is the very edge of her pupil. Now, we kind of looked at this briefly in one of those previous slides. Remember I talked about how the edge gets snipped out? Okay. So this is telling us that she's got a problem. And her problem has to do with protein digestion. And hopefully you know how protein digestion fits in with this, but just in case you don't, I'm going to give you Stomach 101. We call this marker comb teeth because it kind of looks like the teeth on a comb. And when we see that, we want to ask about the stomach and our client's ability to digest protein. Now, most people don't know if they digest protein well or not. They haven't a clue. And so you need to help them figure out, do they or don't they? And this is what we're going to talk about. We're going to talk about gas. Yeah, everybody passes gas. We know that, right? If your client passes gas that is absolutely putrid, I will often describe it as eye-watering and room-clearing. That is a problem digesting protein. That protein is literally rotting in the gut. It's not getting digested. There was a study published in the International Journal for Vitamin and Nutrition Research in 2011 that reported that higher protein diets, but not exceeding 2 grams of protein for every kilogram of body weight, increased calcium absorption and bone strength. Isn't that interesting? For years we've been saying, and it still holds true here, that too much protein could acidify the body and deplete calcium. And because of that, a lot of people backed off and backed off and backed off till they were almost not getting any protein at all. Wrong answer. They need up to that sweet spot of about 1.5 to 2 grams of protein for every kilogram of body weight. So when we see the comb teeth in here, this tells us we need to support protein digestion, and we need to ensure that they're getting an adequate amount of protein every day in order to protect their bone density. So what kind of things would you suggest to help with protein digestion, to support protein digestion? We'll give you just a minute. Oh, lightning fingers. Oh, you guys are so good tonight. Yeah, lightning fingers. Okay, so for protein digestion, digestive enzymes. Yeah, we're going to narrow that down a bit, but that's a really good start. Enzymes, yeah, bitters, food combining. Yeah, bitters are more liver related. We're going to talk about those in a bit though, so hold that thought. Protease, yeah, protease is where we want to really end up here, and food combining is really important too. Excellent, excellent, excellent. And so when we choose an enzyme, well done, well done. Again, I'm really appreciating you playing with me on this. What about bitters for stimulating stomach? Okay, you win. You win, Kinu. And I hope I'm saying your name right, Kinu. Or is it Kainu? Sorry. She says, what about bitters for stimulating stomach acid? Yes, you are right. I tend to think more about bitters for bile and gallbladder and liver, but you are absolutely right. And we are actually going to touch on that. Yeah, you know what? I'm not afraid to admit I'm wrong. And so Kinu is correct, I'm hoping. And so there we go. And digestive enzymes, just clear those comments. There we go. So now beyond that, we've already talked a little bit about the things that they should avoid, and we're going to deal with this protein digestion again in a moment here. Let me get back to where I'm supposed to be. All right. So when we see the osseous netting, and we see that in here and down here, we've seen these eyes before. Remember, it suggests bone risks. And when we see the comb teeth, it suggests potential problems with the stomach lining, which translates to protein digestion problems, because remember, the stomach is only interested in protein digestion. It does not do anything else. So we need to ask questions about bone health and protein digestion, and then we are going to need to teach nutrition along with how to support that protein digestion. It's also important to remember that we are looking at a genetic predisposition here. We are not looking at absolutes. Seeing the marker in the eyes again tells us there's an increased risk. It doesn't tell us there is an active problem. Conversely, and I know I've mentioned this before, and you're going to find I mention everything 2 or 3 times just to make sure you catch it. Conversely, the absence of a marker does not guarantee a problem won't happen. You might have a genetic predisposition to have the strongest, healthiest bones possible, but by eating poorly and neglecting your health, you could earn the right to have weak bones. If that's what you want, you can have it. So we've talked a little bit about what to avoid already, and we're going to just review that list again. We didn't touch on smoking. Smoking, excessive alcohol intake, and of course lack of physical exercise all suck the bone right out of you. Fizzy drinks, coffee, black tea and green tea, white sugar, refined sugar, white flour, excessive salt, and excessive red meat consumption are all things we want to counsel our clients to not do. The third marker is called the stomach ring. Now the stomach ring is this right in here. For those of you who have some iridology background, if you studied with a Jensenian iridologist, you will have different names for these. Like you would probably call this the sodium ring. Or you might say the stomach is over acid, or you might have another name for it. We're using the IIPA terms here, and this is the stomach ring. This eye has a very clear stomach ring, very clear. This again is inherited, and so that means it's genetic. We should not be able to see it this clearly. This is actually the sphincter muscle showing through the other layers of tissue. So the sphincter muscle is the muscle that when it contracts, it's going to make the pupil smaller. And if we can see the edge of that muscle and see the rest of it in here, we know we are missing a layer or two or more of tissue. Whenever we are missing tissue, we have a reduced resiliency. So in this case, it means a lowered resiliency in the stomach, which is going to translate to a reduced ability to digest. If digestion is impaired, nutrients cannot be properly prepared. If nutrients are not properly prepared, they can't be absorbed. And if they can't be absorbed, they can't be assimilated. Right? I think we all agree on those points, right? Does no good to take supplements or even eat. That's maybe going a little far if you're not digesting and assimilating. We want to get the most out of it. We've seen these eyes before. This is that 60-year-old we talked about. Notice that her stomach ring area is darker than the entire rest of her eye. And this is telling us that her stomach resiliency is much lower. Again, she was born like this. She didn't do this to herself. She was born like this. The ability of this stomach to produce digestive juices and enzymes is low, and this is a genetic indicator. In order to digest protein well, the stomach is only interested in protein. I mentioned that a moment ago. The stomach must secrete pepsinogen and hydrochloric acid. The hydrochloric acid changes the pepsinogen to its active form pepsin. The dark stomach ring suggests a reduced ability to secrete hydrochloric acid. So this client is likely going to do best using a betaine hydrochloric acid supplement, because that will help her to activate her pepsin. And I would go so far after a couple of months, if we still had really foul gas or any indications that she wasn't actually dealing with her proteins properly, I would consider adding an enzyme that had protease with it to make sure that we've got things covered, that maybe had some pepsin in it as well, to try to really power punch her protein digestion. Here's a male, age 20, and again we have a very prominent stomach ring. Reminding you this is an inherited sign. So what other kinds of things would you do to enhance the production of hydrochloric acid? And or to support the digestion of protein? We've talked about enzymes, we've talked about hydrochloric acid, we've talked about protease. Is there anything else you would do, maybe some foods or some herbs that would work? Eating bitter foods like dandelion leaves, absolutely. Arugula, yeah. Some places in the world they call arugula rocket. Apple cider vinegar in warm water, yeah. And ginger, yeah, absolutely. Not drinking too much water with meals, right on. What about getting the microbiome checked? Yeah, you know, if he's got a way to get his microbiome checked, that might be good. Now, of course, microbiome is moving further down the system. It's much more intense in the intestinal tract than it is in the stomach itself. I'm not sure how much microbiome there is actually in the stomach. So that's a really good question, Brenda. Do you know how much microbiome there is in the stomach? No, okay, fair enough. Yeah, I tend to think of microbiome as more of an intestinal thing, but the truth is, if the stomach isn't working right, the problems all flow downhill, right? And so if he's not handling his proteins properly, the likelihood that the microbiome in the intestinal tract is messed up is right there. And so while the microbiome is not going to necessarily improve the protein digestion, it will improve everything overall. So yeah, if there's a way to do microbiome testing, that would be good. The acid is supposed to kill bacteria. Absolutely, it is supposed to kill bacteria. So I would expect that there's not a lot of microbiome in the stomach. All right, so touching on these bone indicators is just a tiny part of what iridology can do, right? Some of you have been with me for a few other classes. Some of you have been with me for a lot of other classes. Some of you are brand new to me, but we are just barely even touching the tip of the iceberg. For example, I just want to flip back because this eye has some interesting stuff. Not only do we have the osseous netting, not only do we have the stomach ring, we've got some other colors in here that teach us different things. We have a very interesting piece over here, which is not something we want to see for a couple of reasons. The shape gives us one indication, and the dark color intensifies that. We've got lots of little dark patches, which are not cool. We've got all this fogging coming up at the edge, and we haven't even started to look at the sclera to see what it's going to tell us about the dynamic here and now. Most of what we see in the iris is genetic. This white stuff is not. It may be, but it usually isn't. And then looking at what we see in the sclera tells us what's happening in her body right now. So everything in here. There's, oh, we've got, Brenda, yeah, we've got tons of crypts. We've got, this is, you might have studied this as an asparagus tip lacuna. Yeah, there's lots of different stuff going on in this eye that we certainly can't go into right now. But that is what learning iridology is all about, right? So when we touch on these indicators, you've seen how we can put 2 or 3 indicators together. We're not done with this yet, to really add power to the story you're seeing and to help you understand better what you can do for your client to help your client regain their health or maintain their good health. There are more markers than we have time to cover in this session, and there are markers that will tell us if the person is prone to connective tissue disorders. So if they're prone to sprains and breaks and unstable joints and things like that. We can look for specific markers in specific limb areas. For example, we could look in the leg area, we could look in the arm, in the shoulder, in the rib cage, in the spine, and see markers there as well. If you want to learn that kind of useful detail about iridology, you will be excited to know that the next go-round of Confident Nutritionist Dynamic Iridology is starting in January. Registration opens today. That's very exciting. And space is limited to 10 students per class. This is an online class just like what we're doing now with live webinars, and I'll tell you more about that in a minute. The course starts January 17th and it goes till somewhere mid or late June. And I'll explain why I have that flexibility. You have a choice of an 11 a.m. to 1 p.m. Mountain Time session or a 6 p.m. to 8 p.m. Mountain Time session. So you register for the time slot you want to attend your class in. And the registration link is now active. So if you want to get in there and get registered, you certainly can. And remember, only 10 students per class. So it is limited space. And I'll tell you in a few minutes why I limit that. What will you learn in there? What's the big picture? You'll learn how to create programs right in your sessions and eliminate unpaid homework time. You've had a taste of that here as we've started pulling in what you already know. You see the signs, we pull in some of what you already know. How to do a base assessment in 5 minutes or less without lengthy intake paperwork, save time, and do a better intake assessment. I will show you later on. I will do a base assessment, and I will show you that when you know your markings and you know what they mean, you can actually do a base assessment in about 1.5 to 2 minutes. And then you know what questions to ask. And you will only ask questions that are relevant to your client's needs. So based on the shopping list your client has brought in and connecting that to what you see in the eyes, ask only questions that are relevant. You're not going to be off in left field. You will learn how to prioritize the problems your client needs help with. So important. You'll learn how to connect what you know about nutrition and or herbology with what you discover using dynamic iridology. And you've seen that today. You've got your nutrition, you've got your herbology, and you've seen how we pulled that in. It just makes it so easy to tie those disciplines in. You will learn how to do a deeper assessment for more direction and understanding of your client's needs when it's needed, but it's not needed on the first appointment. Specifically, you will learn beginning to intermediate iridology, and I will guarantee that beginning to intermediate with a base in sclerology gives you way more information than you need to do a solid iris assessment. I guarantee it. You will have this at a level to prepare you for the International Iridology Practitioner Association certification exam. If you choose to become certified, that's an additional fee payable to IIPA. We will tie in your basic nutrition and herbology as they relate to iridology. Once you've really caught the feel of how to tie it in, you aren't going to need to be taught. You will find that it just flows, and that's what we want to see. This course, you just need to know I'm not teaching nutrition or herbology per se. I'm teaching you how to pull that in, and we will cover bits and pieces of it. I will also teach you how to create and address therapeutic priorities for your clients. We do a lot of that in our classes. Where would you start? What are you seeing in this eye, and where would you start? Now, what if we have all three of these signs in one eye? Where is that going to take us? This is a female, age 54. And I want you to really understand as we do this that no one sign is definitive in and of itself. So even if you see the osseous netting, that's not enough for us to go, wow, this person really probably has bone problems. We can put that on our potential list, but then we want to look and see, are there comb teeth? Yes. Is there a stomach ring? Yes. Now we've got three pieces of information that are all saying may not be able to digest, assimilate, or absorb, assimilate, and therefore may not be able to end up in the bones. Now we've got a picture here. We want at least 2 marks of some kind, 2 iris signs that we can fit together to tell a story before we take that story very far at all. There was a study done and reported in 2010 in the sportjournal.org, and I should and it was about resistance training. And it said that although not all studies have shown improvement in bone density with strength training, if done with high enough intensity and for a prolonged period of time, seems to be effective for improving, note that word, improving bone density in middle-aged and older women who have low bone density. So they are proving that we can rebuild bone even after middle age. We just need to do the right thing. So the right foods and the right types of exercise. So I'm not against recommending that my clients work with a personal trainer. In fact, I have one that I refer them to. She's in her early 60s. How perfect is that? This is another client of mine. She is 58. She has a diagnosis of osteoporosis, and she's experiencing stomach problems. You can see here that she does have osseous netting, and she's got some over here. She has comb teeth, and she has a stomach ring. So with this kind of an eye, I am going to start with suggesting that we work on digestion and exercise first. I want to make sure that she's able to digest, break down her proteins, and thereby use that to help us assimilate the calcium that we need. And, you know, we've looked at some of the individual markers and we've seen how they work together, and you're seeing that in this eye that they work together. Again, always look for at least 2 markers that can be tied together to tell a story before you go saying, oh my goodness, this is what I'm seeing. Right? 1 marker alone doesn't quite do it for you. And to help you get more practice in that, again, the class, right? Confident Nutritionist, Dynamic Iridology, Registration's open. There is your link. Now, herbalists, I'm going to make you a sound promise here. Just because it's called Confident Nutritionist doesn't mean you're going to get left out. I am also a master herbalist, right? We are going to tie that in. And as a matter of fact, you're going to see later on, one of the things that you get with the class as a gift ties it in beautifully. Are any of you members of CANNP or IONC here in Canada? No? Oh, yes, okay. No, okay, fair enough. Oh, and I know, yeah, okay. CanPro, all right. All right. So we have no CANMPs and no IONCs. Fair enough. Fair enough. We will move on then. So why would you want to study with me? Hopefully you love the way I teach. That would be the first thing. Beyond that, and Flora, if you're raising your hand to say that yes, you're a member of CANMP or IONC, you have a special registration link in your newsletters that you need to use when you register for the class. Just reminding you of that. Why would you want to study with me? Because I've been where you are. I have. I've been where you are. I understand the financial and time constraints of running a business, taking care of a family, home, friends, and other important commitments. Remember, I built my business while having and raising 7 children. I understand busy. And now I've got aging parents that are needing more care, and I am the only child within 12 hours of them. So I understand busy as, sandwich generation kind of stuff going on. I understand learning needs. Before I became a holistic practitioner, I was in university studying to be a school teacher, and I was about a semester away from graduating when I actually decided I didn't want to teach children. At any rate, then I went and had 7 of them. But I know that we don't all learn in the same way. And so I try to approach teaching from a lot of different angles. I understand there's a lot to learn about iridology and sclerology, and it can be overwhelming. So I've got a lot of different educational pieces in place to help you with that. And it's less expensive to study with a Canadian teacher who charges in Canadian dollars. We will talk about that again in a moment. Here's what one of my recent students said. The amount of learning is enormous, and there's a lot of depth to this course. Judith's teaching is professional and easy to learn. She stops for questions, has great slides, reviews every week. Her students are her priority, and their understanding of the information is imperative to her. It absolutely is. There's a website that's a private student website where you can get all your downloads and watch the videos. We have a Facebook page that is a closed group only for my students and alumni, so we can discuss iridology, focusing on what you're learning in the course. She says, I would definitely recommend this course to anyone who's even thinking of taking an iridology course. Judith is a wealth of knowledge and a fantastic mentor. I love this course, and I know you will too. Karen Choate had this to say. She said, having recently completed the Confident Nutritionist program with Judith, I can honestly say this is one of the most rewarding, informational, and fun classes I've ever had. She came in previously certified, CNHP, Natural Digestive Health Specialist, right? She has lots of training under her belt. Judith is a born teacher, patient, kind, love it when people say nice things about me. It just gives me warm fuzzies. But above all, she's a master at her craft, generously shares her knowledge, committed to the success of her students. I feel blessed and fortunate to have had such an amazing teacher and to have been a part of her class. I've already implemented several techniques and applied extremely crucial and beneficial knowledge and skills that I learned in this class to my own practice with great success. Thanks to Judith, I'm definitely a much more confident nutritionist. She is actually preparing for her 3rd level on the exams. IIPA has 3 levels, and she's getting ready for the last step. And this is what she sent me just a week or 2 ago. Thank you. It's been such a pleasure studying under you and learning from you. I really miss our class. I hear that a lot. But I'm looking forward to completing this component of iridology and continuing my education, most hopefully with you. I've become much more comfortable with taking photos of my patients. I've begun to implement this incredible work in my practice quite successfully. It has truly helped immensely in my decisions and assessments. So, powerful stuff to help you build your practice. Now, I also promised you some skin markers, right? We're going to cover one maybe 2 here. This first one that we're going to talk about is called a scurf rim. When you look at this picture, can you see how it's dark at the edge? Particularly here and here, and actually on this one too. It is dark. Thank you, Brenda. And so what that tells us is this is the skin zone. Her skin does not like its job description. Your skin is known as your third what? Let's have you type that in. Your third what? Your skin is your third. Brenda, dang, you're fast. You are so fast. Your skin is your third kidney. Well done. Good job. Your third kidney. It excretes the same kind of waste that your kidneys do. Remember what we said about some other things when we were looking at specific markings? We said it's dark inside. We don't like that. Dark means less resilient. This is telling us this client's skin is not resilient, and it tells us that she is at a greater risk for skin issues. So, and those issues typically look like eczema, psoriasis, that kind of stuff. But she's a little bit different. She's 24 years old, and she is a dancer. She dances, she teaches dancing, and so she dances probably 2 to 4 hours, 6 days a week, right? And she dances hard. She sweats. And as a result, because her skin is not tough and strong, she is very susceptible to skin fungus. And she tends to have a lot of fungus on her chest and on her back. So during the dance season, by the time we get to mid-October, right through till the end of June, when the recitals and the competitions are all done, her back and her chest are a mess. She's in sweaty, wet dancing clothes. And we've talked about you need to change your shirt every hour. And it's like, well, how many dancers have that much wardrobe to change your shirt every hour and not do laundry every day kind of thing, right? But then once dancing is done and she's got the summer off, it clears up. So that's one of the things that we could see here. She might break out an eczema, but she doesn't. Her skin is not strong enough to ward off a fungus. Her diet's pretty good. So we do topical herbal antifungals. We do oral antifungals that are herbal as well. And it helps a little bit, but it's not enough. This is a client who's female, age 58, and when you look, you can see again that there is a bit of a dark frame, and it kind of hangs out under this yellow mucky stuff that's at the edge of her eye. And I would never tell her to her face that this was yellow mucky stuff. I promise I wouldn't. I would give it some other names instead. I would describe it technically, not emotionally. And so what we know is that that means her skin is a little bit at risk. But what we also see is she has a lot of pigment that tells us her liver wants to be a troublemaker. The liver has an awful lot to do with the skin health, right? And we know that from even herbs. Things like Oregon grape, beautiful liver herb, fabulous skin herb. So we have lots of situations where the liver herbs also work on the skin. Now she's a little bit different too. She only breaks out with eczema when she's under extreme stress, and I mean off the chart extreme stress. And she only breaks out in 2 hand-sized patches, one on the back of each calf. I'd like to do a little psychological study on her to figure out what's going on with that. But she has found that if she is aware that she's walking in distress and she jacks up her B vitamins, she jacks up her borage oil, and she jacks up her liver support, she can totally avoid developing those eczema patches. Notice also that she has comb teeth. I'm not going to point to them. I'm going to let you find them. And she also has a stomach ring. So does she have osseous netting? A little bit. A little bit. She's got some other marks that are more significant than osseous netting, but she's got a little bit. All right. So as we look at those things and we're thinking, yeah, what else would I learn in the class and what's included in the class? Well, the class is 20 sessions, 20 live webinars that are about 2 hours each, so presented just like we're doing here. Each class is recorded in its entirety and posted on the student website. And that's important because you might have to miss a class here or there, right? And if you do, not a problem. Just come back and listen to the recording. Totally convenient. And because it's recorded and because it's online, there's no travel expenses, no time away from home. Easy peasy. The content, course content, is edited also into short topic videos, so you can listen to the whole class front to back, or you can just, after you've listened to that, if you need to review a specific topic, each topic has its own mini video stored on the student website to review for 18 months from your start date. And after the 18 months, you are migrated to the alumni site, which has all of the most up-to-date, latest materials that I'm offering. Right? I keep that site up to date, constantly updating it so that once you've graduated from your class site, you still have access. As we learn new things, you have access to it. Digital textbook that is made available in weekly installments, and I'm really a stickler on this one. And I say that because I don't want my students working ahead. Iridology is the kind of a thing, it's kind of like math. If you don't have the foundation, the advanced principles make no sense. So I want you to be solid on what we cover every week before you get a peek at what's coming out. Each class always starts with a review of the previous week. It's an extra chance for you to ask more questions if you didn't ask them on the Facebook page. Each week has lots of in-class practice and interaction. So unlike tonight where I have your lines muted because I never know how many people are going to join me on these webinars and I don't know what their background noise situation is, in class I unmute all the lines. You mute yourself if your dog is going to bark, right? And that allows us to talk back and forth, for you to ask questions rather than type them in, and for us to really make sure you are solid because we are talking. Certificate of attendance for attending 80% of the classes live. Many of you have other training and you have other affiliations, and that means that you have to get CEUs, right? Most organizations require 20 CEUs per year or 25 CEUs per year. Many of them will accept this iridology class for your CEUs, so that's a bonus to you as well. What is the tuition? It is $19.95 Canadian. Those of you that are in the US, just want to take a moment to explain, because I find that you're not used to purchasing in Canadian dollars. We are very used to purchasing in American dollars when we shop online. Your dollar in the States is worth about 30% more. So when you go to register for the class, it'll say $19.95 Canadian, but then what you will see go through on your credit card or through your PayPal account will be more in the range of about $13.95 US, depending on what the exchange rate is the moment you press the register button. Okay, so it's going to cost you, it's a smaller number in US dollars. Canadians, you're really excited that you can pay in Canadian dollars and that you're not paying in US dollars, because it would be 30% more than this, and that would be nasty. But here's what I want to tell you is that if you are ready to commit, if you know right now that you want this class and you are ready to commit, even though it doesn't start until January 17th, and if you will commit before December 1st at 5 p.m. Mountain Time, you will get a $200 discount. I want to put these numbers into perspective. You will look online and you will find iridology classes. The content that we are teaching takes about 5 to 6 days to cover if we were to do it front to back. I mean, it's 40 hours of content, right? Most teachers split this into 2-3 day weekends. If you had to fly to another city, how much is your airfare going to cost, especially if you have to do it twice? Then you've got your hotel and you've got your meals. Most teachers in the U.S. are charging $700 to $800 U.S. minimum. I did see one the other day that is charging $1,500 US for just the course. And so you decide what the deal is here, right? Because really, this is a sweet deal. However, the thing that I have noticed is whenever I leave town to do a workshop, to go and take a class, I always get at least one emergency phone call. When the kids were little, it was one of the kids had fallen and my husband had taken them to emergency for stitches. Or there had been a call from the school that there was this crisis happening with one of our kids. Now it's more like I get the emergency phone call saying one of our parents has been admitted to the hospital, right? Those things never happen when I stay home. So I'm just saying, I stay home as much as I can, and I do online courses as much as I can, because I do not need more drama in my life. If your life is the same, then this is your safety valve. Do the course online. The other thing is that how do you handle doing 3 full days of workshop that's really intense, or 5 or 6 days that's really intense back to back? My brain turns to mush by the end of day 2. By the end of day 3, I've stopped taking notes. And by day 4 and day 5, I'm wondering when the San Blaise is this going to be over. Even if it is a topic that I desperately want to learn, my brain only absorbs information so quickly. So by doing 2 hours of class a week, you have time to learn it, go and practice it, bring it back, ask questions, and we build. It's a much gentler process, and it ensures that you are more likely going to get the results you want and not feel the stress. Now, again, this link is not clickable from your screen. I don't know how to do that. I'm not that smart, at least not on this kind of stuff. So write that down because you're going to want it. Now, what if you want to pay payments? Is there a payment plan? Yes, there is, for payments of $549. First payment is when you click the register button, and then 1 a month after that. But if these people are getting a discount, shouldn't these people get a discount because they're committing too? I think so. So they can have a $200 discount as well. But if you're doing this, scroll way down to the bottom of the registration page to find the link for this, because it's not up high. Okay. Oh yeah, we've got some more eyes to look at. I'm just looking at my notes here because we're almost to more eyes. So when is the course? You need to know this, right? It starts Wednesday, January 17th, and it runs till late June 2018. Now, why that flexibility? What I have learned is that when my courses have 5 or fewer students, we can usually cover them in 20 sessions. But often when we have 6 to 10 students, we need an extra session or 2 because there's more discussion. We may not necessarily get through everything that I thought we would in one session, so we carry over to the next week. And if I need to add a couple of weeks to make sure we've covered everything, I am totally not against that. I will do that to make sure that my students have the amount of time they need on the topics. I want to make sure they're solid. Choice of 2 times, and you determine this when you register: 11 a.m. to 1 p.m. Mountain Time, 6 p.m. to 8 p.m. Mountain Time. Choice of 2 times. But remember, somewhere in March we changed to daylight savings time, or on and off. I never know which way it goes. But the times change, so you want to make sure you know how that's going to affect you. Okay, so just double check that as well. So what about this? Oh yeah, I'm just going to take this out because I'm not sure why I put that up there. It doesn't matter what color the eye is. Most of what we've looked at tonight has been blue eyes because they are the easiest to read. They're the easiest to see details in. But I want to show you how quickly you can do a base analysis. Now, if you know what all these buzzwords are, you're going to see how quick this goes, okay? If someone has a stopwatch, go ahead. I'm going to start off here at the core, and I'm going to go, yeah, it's dark, right in here in the middle. I know we've got some digestive things that we want to ask questions about. Look at the colors here. I want to ask about pancreas. I want to ask about kidneys. I want to ask about liver. Then I want to look at these, and I want to go, okay, what do I want to know here? First off, when I have that many of those, I know that I'm at a greater risk for endocrine and metabolic disorders. When I look at how dark some of those are in the middle, right in the heart of them, I know that we're looking at areas that have very reduced resiliency. So this one, for example, I'm going to be asking questions about the bronchioles. The base of the bronchioles may be the base of the thymus. I'm going to be asking about the pancreas here. I'm going to be asking about the ovary here. I'm going to be asking about, it could be pancreas, it could be solar plexus. And up here, I'm going to be asking again, probably about pancreas. I'm going to be asking about liver enzymes. I'm going to ask about cholesterol levels. I'm going to ask more about liver enzymes, and I'm going to ask about kidney function, and these two are very dynamic. Most of what I've mentioned here is genetic. This is very dynamic. This is here and now. The fact that she's got blue eyes tells me I'm probably going to be working with someone who's a little prone to being slightly over acid anyways. There we go. Base assessment done. When you understand all of those buzzwords, you get that picture right up front. And you know how when you were learning to count, you had to count all of the individual pieces. The teacher would give you 5 blocks and you go 1, 2, 3, 4, 5. But by the time you got to be about grade 3, end of grade 2 into grade 3, she'd put a handful of blocks down and you could look at it, not count it, and you knew how many there were. That's what iridology is. You get to know it. You don't need to analyze every little detail. You just simply look at it, see it, and put the picture together. And that's how your base analysis works. When you've seen those things, you've written them down, you start asking questions. How is your digestion? How are your blood sugars? How are your kidneys, especially with seeing this and this? Any kidney issues? So kidneys could be blood pressure, could be gout, could be fluid retention, right? We look and we see the liver, and then we see this marking, and we see this, and we ask, how's your cholesterol? What's your liver doing? Any hardening of the arteries in the family? Then we start looking at these individual markings, and we put them all together and ask about endocrine, any hormone imbalances that we need to be aware of, any ups and downs, any mood swings. And then we can look at them individually and ask about the specific organs that could be involved. So we get that overall picture, then we can come in and laser in with the specific questions. Tie that in with what your client brought in, and you've got the assessment that you need. Like I said earlier, we've looked only really at blue eyes because they're the easiest to look at. Brown eyes are harder to analyze. Oh, disregard this because it is a link that doesn't work. I've missed that. Proofread these slides 7 or 8 times and missed that every time. Wow. So when we look at a brown eye, we know that we are looking at someone who has more of a tendency towards liver and or blood issues. We look at how this looks very raised and very 3D, so we're going to wonder a bit about bowel issues and blood sugars. We look at how we've got all of these marks around here, and again, we're going to be asking endocrine system questions. We see the dark brown here. We know we really want to ask liver questions. We see these teensy-weensy little dark bits. We want to ask about any kinds of history of degenerative situations in the body. We see a bit of a white glaze at the edge of the eye. We want to ask about liver and enzymes and cholesterol. We see these rings coming around in here. And we want to ask about nerves, stress, how they handle stress, and maybe look at some B vitamins. This eye also has a lot to tell us. When we have these radiating out and these coming around, this person spends most of their time functioning in their sympathetic nervous system. So we're going to need to work with them to help them to learn how to relax, the B vitamins, calcium, magnesium, maybe some essential oils, and talk about getting into some meditation or some gentle yoga or some kind of gentle exercise routine. Again, we've got the liver enzyme question that we want to ask because we've got the brown eyes which suggests liver, and we have the white haze which suggests liver. We have a blue haze, blue-purple haze at the edge of the eye which suggests circulatory insufficiencies, and we have this netting around the edge which suggests a predisposition towards food allergies in particular. Right? We see all that in there, and we start tying liver to food allergies. We tie all of that to stress levels and adrenal function, and we have the picture. And we can begin making sound and really useful recommendations. Remember, the sclera is very dynamic. This is what's going on right now. The iris is more genetic, although this is usually acquired. So there are bonuses with the program. You like bonuses, right? You want to get the most bang for your buck, and here are the bonuses that I'm including. An IIPA student membership. Towards the end of your program, I will gift you with an IIPA student membership. They charge in US dollars, so I listed it in US dollars here. I think it's important for us to be rubbing shoulders with like-minded people and to have the opportunity to continue our studies as a group. I've devised the Iridology cheat sheet. Remember I said herbalists, I wouldn't leave you out? Well, the Iridology cheat sheet is a booklet, about a 30 or 40 page booklet. We're just doing the final revisions and formatting on it right now. And it gives you the name of the marker, what the marker looks like, the questions you would ask, herbal recommendations, food recommendations, and lifestyle recommendations, all on a handy-dandy chart form. We have a private Facebook group that is just for my students and alumni, and that Facebook group will be active for as long as I'm teaching. And I'm not planning on retiring soon. I like teaching too much. Once a month we do a coaching webinar, so like this, but it's where students have submitted cases they're working on, whether they can submit photos of some quality or not, or whether they are sending in a written description of what they saw and a written case history for us to discuss to help talk them through it and help them just hone what they're doing. For the third level of the IIPA exam, should you choose to do the IIPA exam, you are required to have it supervised. And most of the time, the supervisors want to be paid. So that would be finding a justice of the peace. It might be a pastor at your church, but you need to find somebody who's trustworthy, and they sign a form saying they're trustworthy, but they often want to be paid. If you decide that you want to come to Calgary to write your exam, and I offer 3 or 4 exam dates per year, I will supervise your exam for free, and you will get the 1 day of live review with me the day before your exam for free. If you are not one of my students, you pay $300 to join us, and then you pay me to supervise your exam, if you want me to supervise. The first level of the exam is doing 10 iris analysis cases. Normally you would have to find your own cases. You would have to find a way to get photographs of them, and then you would do up a big fancy report, which is not how we're going to do iridology in the long run, but it's the way you get tested. You submit those to me, and I mark them. To make things easier, I provide you with 10 iris analysis cases, so 10 sets of eye slides, actually 12, and you choose 10. And they're online. You write up your report, you write up your evaluation, you send it to me. I spend at least 5 hours marking them. And then I give you 1 hour of private tutorial to review those cases to make sure you're solid. And there's usually 1 or 2 things where I can see clearly that the student hasn't grasped a particular concept. It gives us a chance to pinpoint the concepts that have not been grasped and to really reinforce the ones that have. Level 2 of the exam is that once you've passed off the 10, then you do a case study, which is really just another one of these, but it's with a case that IIPA has provided. They give it to me, I give it to you. And I give you the 1 hour that it takes to mark it, and then 1 hour of private tutorial to review that case. A lot of instructors out there are charging $300 to $500 to do exam prep, right? And right, and so there we have that. The IIPA exam is $175 payable to IIPA, not to me, and you only pay that when you are ready to take the exam. So what is the tuition then? Again, if you register before December 1st, it's $17.95, or 4 payments of $4.99. At 5 p.m. on December 1st, these discounts disappear, and the tuition will go right back up to $19.95 and $5.49. So seriously, if you want to take the course, I strongly recommend you get in there right away. There are only 10 spots in each class. The benefits of what you're going to learn, you've already figured this out. No more unpaid homework time. You will be able to create therapeutic sequences that will help your clients be more successful and keep them coming back to continue their wellness journey. You'll be able to eliminate lengthy intake questionnaires, develop rapport within minutes, and you will be more precise in your client work. Absolutely. So I invite you, if you're ready to commit, if you want to do your iridology, get certified, add it to your tool belt, this is the time to take care of that and get in there. I really believe in high touch, high contact. So what that means is when I see your registration come through, I will be phoning you within 2 business days to make sure that we proceed with the rest of the things that need to be done to get you fully registered and to walk you through that little process. It's not hard. It's just I need to send you a form, have you fill it in and return it to me, and we are ready to go. So I really encourage you to get in there and get registered while there is still room, because again, once the class is full, there will not be another one offered right away. So I look forward to having you in class, and I wish you a very wonderful evening. Good night.